So one of the things I focus on for my patients post-op, and as well as in the hospital is, again, safety always is my number one thing, is my number one priority. So we make sure patients are good candidates from all their comorbidities, meaning all their medical problems. Secondly, we make sure we do things safely. We're not going to try to pull too much tissue out. I tell patients my goal is to get as much as possible safely. I try really not to give a number. I know that's kind of one of the things that patients are always looking to get is how much did you pull off or how much are you going to pull off. But there's studies that have shown that the number really doesn't matter. And those studies were done in Germany and they looked at hundreds of women. So it's a pretty good study. So I tell patients the number doesn't matter as long as the person's doing it safely. I also like operating most of these cases I perform at a major hospital. That's where I work. But that's also where they can spend the night. There's a nurse watching them 24/7. They're hooked up to monitors if we need them to be. And then the next morning we can check labs. I think the one thing that patients probably underappreciate is that liposuction is dangerous because there's a lot of fluid shifts that happen afterwards. When you do a liter, probably not so much. When you do two liters, same. But when you start to get into 7, 8, 9, 10 plus liters, that's a big hit on the body, and the body is making a lot of inflammation, and there's a lot of shifts in the fluids, in the spaces, and that can cause someone to get dizzy, it can cause someone to lose blood as the blood is shifting out of the intravascular space where it's supposed to be. And ultimately that can, be a really bad outcome. So keeping patients overnight for me is a top priority if I'm doing high volume liposuction.